So welcome to the new video of renal physiology. So basically this might be the last video of renal physiology. Then we will start with the micturation reflex. Okay. So what is micturation reflex? So basically when bladder gets full, okay, of urine, so what happens is we get a reflex by the brain to go to micturation. So this is known as the micturation reflex. So now there are two conditions. Okay, so in micturation reflex the bladder is full, okay, or the bladder is it is not slightly, it is slightly empty, like a little amount of urine is present. So we not tend to go to urinate like every now and then. Basically if there is 10 ml of urine or 20 ml of urine or 30 ml of urine, we basically do not usually go to micturate. The micturation reflex is not initiated. But if it is 100 ml, 90, 150, then like 160, 170, 200, then the micturation reflex is initiated. So we will consider two conditions. Okay, so basically the first condition will be bladder is partially filled. Okay, partially filled. So basically what is happening, this is the urinary bladder, this structure. Okay, so for example, like not much amount of urine is present, let's say 10 to 30 ml. Okay, a random value. Okay, 10 to 30 ml. So now what happens is the micturation reflex shouldn't be initiated. Okay, so what happens is, let me just first label the diagram, then I will draw the neuronal circuit. Okay, so basically this is the internal urethral sphincter. I will write it in short. This is the external urethral sphincter. Okay, now this structure, okay, this which is this level of vertebrae, so basically it is the sacral vertebrae, and this above vertebrae, it is the thoracolumbar vertebrae. Thoracolumbar vertebrae, T11 to L2. Okay, now what is this yellow structure? This yellow structure, basically I will write it separately. So basically this is the inferior mesenteric ganglion. Okay, now this structure is the pons. So I have drawn a very basic schematic diagram. Okay, so no need to label this pons. We have some centers in the pons. Okay, we have to label them, and this is as usual the cortex. Okay, so now tell me one thing, if 10 to 30 ml of urine is present, so we do not tend to urinate. So what happens is, we have some, let me just draw the urinary bladder, a double layer structure. Okay, like it is a muscular structure, so I will draw it like that. And let me clear one thing. Okay, this color will be the afferents going to the brain, and this will be the efferents coming from the brain. Okay, first I will draw the afferents. So what is happening is, these are some sensory nerves. Okay, so these are branched structures. Okay, so the sensory nerves, basically they carry impulses, go to the sacral vertebrae. Okay, and synapses here. Now since the urine is not enough to stretch the bladder, okay, so this neuronal circuit, like the nerves, do not carry like the impulse for micturation reflex, okay. So basically the synapse here, they go in the thoracolumbar vertebrae, they also synapse here, and now they go to the pons. Crossing the pons, like just I will crossing the pons, they go to the cortex, okay. Now what happens is, since the urine is not like enough, okay, so we shouldn't like initiate the micturation reflex. So now what happens, the cortex sends some signal. So now we will go to the efferents. So what happens is, the cortex sends signal to the pons. Let me just draw it till here, okay. The reason I have drawn it till here is basically like we have to draw two centers, okay. Basically the pons now plays an important role. So I will just highlight the two centers, okay. So what are the centers? So basically, let me just write it here. So the red one is pontine micturation center, and the blue one is pontine storage center. Now tell me one thing, if there is no urge to urinate, okay, so basically what will happen, which center will get stimulated? Yes, the pontine storage center. So basically it goes to both, a positive signal to pontine storage and negative signal to pontine micturation, okay. Now what happens, since pontine storage center is stimulated, it goes to the thoracolumbar vertebrae, okay. Its synapses here, just like just a second, okay. Then it goes to inferior mesenteric ganglion, okay. Its synapses here, and then it gives one branch to the urinary bladder and one branch to the internal urethric sphincter, okay. I will discuss the action a bit later while discussing one branch. Then one branch comes from this nerve itself, it goes to the sacral vertebrae, its synapses here, and then it goes to the external urethric sphincter, okay. So now it's time for discussing the actions, okay. Now I will write the actions. So basically the heading shall be, okay, actions. Now tell me one thing, we have given three efferents, okay, to the internal urethric sphincter, okay, the external urethric sphincter and the bladder, okay. So what is happening, we have to store the urine, okay. So looking at the figure, we have to store the urine. So what will happen, like the bladder will contract or the bladder will relax, the two sphincters will relax or two sphincter will contract, what will happen? So imagine if there is a balloon filled with water, and if you like press the balloon, okay, so what happens, the water comes out. But if you do not press the balloon, the water doesn't come out, and like you constrict the end of the balloon, okay. And if you let it relax. You do not press it. Okay, just you constrict the end. So what will happen? Yes, the water will not come out. So basically our hand which is constricting the end is a sphincter. Okay, the internal and the external urethral sphincter, and the act of not pressing, okay, is relaxation. Okay, so from this analogy you have come across, the bladder will relax, the internal urethral sphincter will contract, the external urethral sphincter contract. Okay, so this was the case when there was 10 to 30 ml of urine. Now let me just draw this figure again. I will come in a bit. So now I have drawn the same diagram. Okay, and the information remains the same. Oh, I forgot the inferior mesenteric ganglion. Sorry for that. Inferior mesenteric ganglion. Okay, so basically this is the same figure. The neuronal circuit is same. Okay, just some differences in the activation, but we will draw it. Okay, so it will be better understood. So inferior mesenteric ganglion, the afferents will be the yellow color and the efferents will be dark yellow color. Pontine micturation center and pontine storage center are also shown here. Now imagine the bladder is full of urine, like let's say 100 to 200 ml of urine. Okay, so now it is important to micturate. Okay, so let me just draw it. So it will look like 100 to 200 ml. So 100 to 200 ml of urine is present. Okay, so there is urge to micturate. Now tell me one thing, what we have drawn at the first in the neuronal circuit. Yes, the sensory nerves to the bladder. Okay, so the sensory nerves basically they carry impulse, they go to the sacral vertebrae, synapses here, go to the thoracolumbar vertebrae, also synapses here, go to the cortex, crossing the pons directly. So this was the if afferents. Okay, easy one. Okay, now the efferents are a bit changed now, like the efferent is changed at one point only. Now I will draw it till here. Earlier I have did. Now tell me one thing, we have two centers, pontine storage and pontine micturation. So which center will be stimulated now? Yes, the pontine micturation center. So basically positive, negative. Now efferents from the pontine micturation center will go to the inferior mesenteric ganglion synapses via the thoracolumbar vertebrae, and the same story, like it synapses here and go to the, like, just a second, go to the bladder and it go to the internal urethral sphincter. Okay, now also a collateral branch from here will go to the sacral vertebrae, it synapses here and it will go to external urethral sphincter. Okay, now I forgot one thing in both the figures. So basically this nerve, this is an important nerve, this one. So let me highlight it here and write it here. So this nerve is basically the, yes, internal pudendal nerve. Okay, so this pudendal nerve basically acts as the efferent nerve. So here basically pontine micturation center is stimulated, this sends efferents, okay, to the three structure: the bladder, internal urethric sphincter and external urethric sphincter. Okay, now actions. So basically I should write the actions. Internal urethric sphincter, external urethric sphincter and bladder. Okay, just I will, sorry for this, I hadn't given heading. Okay, so basically bladder is partially filled and bladder is filled bladder is filled moderately. Okay, so now tell me one thing, like if there is a balloon, okay, and if we do not constrict the end, okay, and it is filled with water and we press the balloon, so what will happen? So basically the water will come out. Okay, so using this analogy, so basically what is happening, the act of not constricting the end, okay, is basically relaxing, okay, and the act of pressing the balloon, okay, it is contraction. So basically the internal urethric sphincter and the external urethric sphincter relaxes and the bladder contracts. Exactly opposite to this. Okay, so this was all about the micturation reflex. Okay, you should remember this two vertebrae, the ganglion, the centers and the afferents and efferents. Okay, so this was all about the micturation center or the micturation reflex. Now talking about some applied aspect of the renal physiology, I will give a heading, I will discuss some basics, okay, aspects of renal physiology. So basically applied aspects of renal physiology are like renal function test. At the first, renal function test. So basically we are testing the efficiency of kidneys. Okay, so if we want to test the glomerulus, okay, so glomerulus, so basically we do the inulin test. Okay, so inulin test to determine GFR. Also, along with inulin, the creatinine test is also done. Okay, so basically creatinine test is also for that determine GFR. Okay, so basically, okay, and the urea test. So basically inulin is the best option because it is neither secreted nor reabsorbed. Also it is not affected by diet, while the creatinine test is creatinine is secreted by the body a bit, okay, and the urea is affected by diet. Okay, so basically inulin is the best option for GFR function. Then renal function test, we have the second applied, the glycosuria. Okay, glycosuria is basically the excretion of glucose in urine. Okay, so basically we have to discuss one topic. It is a small topic, we will discuss after this. So glycosuria, we will keep glycosuria as it is. Then there is proteinuria, like presence of proteins in urine. So basically if there is any infection in the body, so basically proteins can appear in urine. Okay, then we have the kidney diseases. So kidney diseases is acute renal failure. So basically what happens is the renal system fails to reabsorb or to secrete some kind of things. Coming to the most important applied, okay, like the metabolic acidosis, along with other applieds, the metabolic alkalosis. Okay, we have studied like metabolic acidosis is decrease in HCO3 minus concentration. Okay, and metabolic alkalosis is increase in HCO3 minus concentration in the body. Okay, so basically respiratory correction like for metabolic acidosis is hyperventilation, and metabolic alkalosis respiratory compensation is like we do not breathe in hyperventilate, we basically hypoventilate. Okay, also the renal mechanism is present, like if metabolic acidosis is present, more reabsorption of HCO3 minus occurs, and metabolic alkalosis, less reabsorption of HCO3 minus occurs. So these were some applied. Okay, so one topic was left. Okay, it was the renal threshold. So this is the last topic. Now what is renal threshold? So what happens is the kidney or the tubular system, then all the other factors of the kidney, every substance has some values. Okay, like for glucose or something like that, there are some values. If that values exceed the substance can appear in urine. Okay, so renal threshold, or better we put the heading transport maximum. Okay, so if there is active reabsorption or secretion of a substance, there is a limit to the rate at which the solute can be transported. Okay, which is often referred as transport maximum. So let me just write it. Substances which are reabsorbed, okay, or secreted actively, okay, has a limit to its rate at which these solutes can be transported. Okay, this is transport maximum. Okay, now this transport maximum, there is one important graph which will be study free in a short while, but let me write something which will blow your mind. Okay, so basically transport maximum for glucose is 375 milligram per minute. So now you will say that but the glucose appears in urine like if it cross 130 or 140 milligram per minute. Okay, so basically what happens is so sorry for my statement that has stated before, the glucose appears in urine at around 170, 180 to 200. Okay, 180 to 200 milligram per ml, per 100 ml. Okay, so why this? Why the glucose appears early than that 375? So basically, okay, I will just write glucose appears in urine earlier. So why this splay occurs? This is splay. It is termed as splay. And why this occurs? As all nephrons it is not compulsory that all nephrons do not have same threshold and transport maximum. So the overall transport maximum and the threshold, like, okay, so it decreases. So basically we have given a graph. Okay, let me just draw the graph. So basically this is the graph. The x-axis show the plasma, just a second, the x-axis show plasma glucose concentration per milligram per 100 ml. Okay, and the y-axis show the reabsorption or excretion. Okay, so the glucose reabsorption, excretion, the glucose filtered load. Okay, sorry, just a second, there is some, sorry for the disturbance. So basically glucose filtered load. Okay, so now tell me one thing. We start from 0. Okay, just a second. So this red line, basically it determines the filtered load. Okay, now tell me one thing. If we start from 0 and till 375, the transport maximum comes. Okay, so basically transport maximum comes. So this graph is like this. This is the reabsorption of glucose. Okay, reabsorption, the graph is expected like this, but we observed that around 200 the excretion of glucose takes place. Okay, so basically and this point, just let me use this white color, is normal. Okay, and this 200 is basically, it is the threshold. So this graph is important. So red one is filtered load, the blue one it curves, and the curve is known as the transport maximum, the reabsorption of glucose occurs, and the threshold, the excretion, just let me write, this is the excretion of glucose. So basically the graph of excretion is green and the threshold is also around 200, like 180 to 200. So basically this is transport maximum. So if the amount of glucose, okay, if it exceeds 180 to 200, okay, in our blood, so what happens is the glucose appears in urine, and this is known as glycosuria. So this was all about the renal physiology. We have completed the renal physiology, all the tubules, then the other things, the applied aspect, and also the micturation reflex. So thank you.